the background of our speakers today. This man is also have a very great milestone, as you can see on the screen. Our speakers today is Dr. Hosung Choi. He took a good education from March 1990 to February 1998 of Yonsei Medical College in Seoul, Korea, and the work experience as a chief board member of Korean Aesthetic Surgery and Laser Society, chief board member of Korean Academy of Facelift and Contouring, and he also active as a global key doctor of Samyang Holding Corporation, Croquis, and other many more and many experience as we can see on the screen. All right, I think we can move to the main session and let me invite Dr. Choi. Is it correct for my pronunciation, Doctor?
Yes, it's very perfect.
Okay.
Thank you.
Okay,
Hello.
Doctor, before we start our session, I would like to remind to the participant if anyone have a question, we can write it down on the chat.
Video threads. For the past 10 years, almost 10 years, I've been participating as a consultant and training instructor of filler injection and thread lifting. And today I'm going to talk about two topics, eyebrow lifts and mid-face contouring using video threads. Now let's have a look at eyebrow lift first. The preferred shape of eyebrows may vary depending on the ethnic and cultural differences. Also, each patient's preferred eyebrow shape may be different. However, we should be aware of the most ideal and standard eyebrow shape. Before performing eyebrow lift, the vectors should be determined depending on the purpose of treatment, of the expectation of the patient. The most commonly used method to determine correct vectors, it is to find the most efficient pulling points and direction by holding up the eyebrow with a fingertip like this figure, which is called flowers maneuver. In general, the target area for brow lift is the lateral 2/3 of the eyebrow. Clinically, lifting slightly more lateral part than the eyebrow can achieve better eyebrow lift. And when lifting this area using video threads, the appropriate vectors is in upward and slightly outward direction. This is a conventional and basic pattern design for the eyebrow lift. However, inserting the thread downward from the hairline is difficult to sustain the effect for a long time. This is because the length of the thread being inserted is shorter than that of other areas like mid or lower face. And too frequent and frequent eyebrow movement may cause the migration of the thread. And if too thick threads are used, they can be touched or visible through the skin, which is especially common in older patients. Therefore, I would recommend to perform reverse insertion technique. I'm going to explain about it in more detail. And use thinner and shorter bidirectional coke threads, and combining with temporal lifting method will enhance eyebrow lifting and will make a long-lasting result. Reverse thread insertion technique is a method of inserting the thread in a direction opposite to the usual direction, from the lower part to the upper part, or from the medial to lateral side. This technique is useful when the basic method alone lacks lifting effects, or a more definite lifting effect is needed even after one single treatment. In addition, this method provides the advantage of wide distribution of the repositioning area, making the result more natural. When combining these two methods at the same time, a much more powerful lifting effect could be achieved by enlarged skin surface for anchoring the tissue by the cogs. However, a longer downtime may be required. When you insert PDO threads to lift eyebrows, the target layer is the subcutaneous fat layer. Looking at the cadaver dissection in this photo, the superficial fat compartments where the threads are inserted and pulled are mainly supraorbital compartment and the temporal compartment. However, if roof, which is a part of the deep fat layer, is pulled together, the eyebrow will be lifted more effectively. So, if the cox thread is inserted at the level of the lower boundary line of the eyebrow, the thread could hold roof and subcutaneous fat layer together, resulting in a more effective brow lift. And if the tip of the cannula could be stuck in the periosteum above the hairline, then a more secure and long-lasting brow lift can be achieved by creating a strong fixation point that will overcome the weak point of the floating cork thread. It is similar to the movement of the body by this fitness equipment. Assuming that this is the entry point for the thread insertion, the moving point corresponds with the eyebrow, and the fixing point corresponds with the periosteum. So the eyebrow will move upward like this body movement. To describe this in more detail, I usually make entry points about 5 to 6 points per side, just beneath the eyebrow. And I use Croquis, which is shorter than used for mid-face or lower face, which is 6 centimeters length with 20 gauge cannula. Of course, it's blunt cannula. If necessary, put 4 or 5 more threads 2 centimeters above the first line. And if you want a more powerful lifting effect, temporal lifting using Croquis with 9 centimeters length will enhance eyebrow lift result. To achieve better results of eyebrow lifting, I often use botulinum toxin injection just beneath the lateral part of the eyebrow to relax the upper lateral part of the orbicularis oculi muscle, which is a strong depressor of the eyebrow. Also, HIFU, or therapy or shrink, is commonly used also to correct brow ptosis. If the patient has an obvious temple hollow, then temple augmentation using filler injection will be helpful to enhance the result of brow lift. This case shows that there's not much swelling just right after the procedure, and that eyebrow lifting effect is well maintained after 1 month. Even 3 months after treatment, the lifting effect of her eyebrows is well maintained. Now let's move on mid-face contouring. As we all know, OG curve is a kind of S-line that is one of the criteria for evaluating cheek fullness, which is also useful as a tool for communicating with our patients. As shown in these pictures, OG curve is more pronounced on the right photo after improving the mid-cheek fullness using thread and filler injection. Let's find out the basic pattern design for mid and lower facelift. At the midpoint, at the point where the line A and B meet the hairline, entry points can be marked. Thread insertion from these 2 entry points to the lower and to mid face can provide an effective lifting. Basically, it is not necessary to insert the threads beyond these two C and D lines because a sufficient lifting effect can be achieved, even if the end of the thread is not located beyond these two lines. Rather, if you put the thread too far from the entry point up to this area, you may see some bulging of thread because there are a lot of muscular movement for facial expressions. And many of young Asian women have pronounced lateral projection of the face due to high cheekbones. They also tend to have a central concavity of the midface, mainly due to bony hypoplasia from genetic predispositions. For this reason, after midfacial lifting procedure in Asian women without careful planning, this lateral projection of the face may eventually become more emphasized. However, this problem can be overcome by choosing vectors close to the vertical, like this right side figure, rather than choosing 45 degrees. Because if you choose the vector with 45 degrees, the thread will probably pass along the zygomatic edge. And lastly, this cheekbone will be more emphasized. So the patients will not be happy with the result. Temporal lifting is a useful way to prevent the widening of cheekbones while providing effective and natural lifting effect. And I put 3 to 5 threads per side, and the entry points usually lie along the line connecting lateral orbital canthus and a little upper part of the earlobe. And I use bidirectional cork thread with 60 millimeter lengths, just like the eyebrow lifting. And appropriate insertion depth is subcutaneous fat layer. So it is very important to advance very gently the cannula to avoid any damage to vascular structures, which can cause some hematoma and prolonged swelling. Depending on the age, facial skin condition, and skeletal shape of the patient to be treated, you can choose the most appropriate design for thread lifting among these various designs to achieve more customized results. However, the large number of threads you put, there will be probably more prolonged downtime. So you can choose between the side effect, downtime, and the efficacy of the result. Now I'll show you the first video about the eyebrow lift technique using video threads. Can you see the video clearly? Okay. First, patient selection is very important. Usually, too old patients with severe ptosis of eyebrows are not suitable for this treatment. So I usually select patients from late 20s to late 50s. I think those patients are the most suitable patients. And before starting treatment, you should check the asymmetry, and you should select the vectors and how much threads you will put. Usually, I start with the lateral part of the eyebrow, and I draw 5 to 6. And also, for this case, I combined temporal lifting to enhance the eyebrow lift results. Because this temporal lifting is very useful because it can provide also more or less lifting result of mid and lower face as well. So the patient will be more satisfied with the result. Local anesthesia, I use lidocaine mixed with epinephrine to reduce any bleeding, because this area, there's many tiny small veins, and bleeding or bruising may happen very commonly. So it's better to use not only lidocaine, also epinephrine. First, I'm injecting on the entry points. When injecting on the entry points, it's better to inject enough amount of lidocaine within a full depth of the dermis, because I will use 18 gauge needle as a needle puncture. You see, I'm holding the entry point with my left fingers. It's to avoid any bleeding, and it's not in order not to lose the entry point. And I'm injecting a tumescent. Injecting tumescent is very important because it can make some space where the thread will be inserted. And also, it can also avoid any bleeding or hematoma during inserting the sutures. And for the temporal lifting, I also use tumescent. But if you put too much tumescent, there will be severe swelling. So I only use 2 to 3 ml per one side for forehead injection, and for temporal 2 to 3 again. So in total, if you put into forehead and temporal together, I almost use 8 to 10 ml of tumescent. And if you think there is too much tumescent inside, then you should wait about 15 minutes. I'm using an owl. It's better than 18 gauge needle because it can produce less PIH or less scarring. Because these days, a small scarring patients are very upset after a small scarring or PIH after treatment. So it's better to prevent. You see, I'm inserting 60 millimeter lengths of Croquis, which is connected into 20 gauge cannula. First, I insert a little deeper, and then I go very superficially. And after finishing my advancement, I try to stick the cannula tip like this video. And to stick the cannula tip into the periosteum, it's better to push the cannula tip with your other hand's finger deep at the entry point and superficial during advancement. And before finishing the advancement, it's better to stick the blunt tip into the periosteum. And then you can create more secure lifting. This time I'm using the same length of Croquis, but it's a sharp needle type. So I think for beginners, it's very difficult. It could be very difficult to use a sharp needle. It has a benefit of fixing more securely than the blunt cannula, but there's weak point of many high chance of hematoma and bleeding. So you can use also a blunt needle, blunt cannula for the second line. Anyway, so I'm inserting 6 underneath the eyebrow, and 5 more and just above the eyebrow. But if the patient wants a little lifting effect of the eyebrow, you only have to put just the first line. For very old patient or a patient who want a very strong lifting effect, you can add one more line, but it's not usual. It's case by case. And for temporal lifts, I use a little longer thread, which is 90 millimeter length. And also this thread is connected to 20 gauge blunt cannula. And advancing this area, you should be very careful because there are many major vessels along the thread path. So keep your cannula's position very superficially throughout the advancement. And if you feel some resistance, do not push strongly. Just you may rotate the cannula gently, then your cannula will be advanced more easily. And this is screw type threads. It's not a routine, a common procedure, but it can help to enhance the brow lift. I'll skip this one. And this is the other side. I'll show you again. Deep insertion, and right after insertion, you should keep your cannula more superficially. And then the last part, you can tense, you can lift up the cannula, and then the tip of the cannula will be facing downwards. And it will become easier to stick the cannula tips in the periosteum. It's not very difficult, but after 2 or 3 cases, you will be very familiar with this technique. Okay, I'll skip this one. For temporal lifting, the vector is more oblique. And I try to keep my cannula very superficial layer. It's just beneath the dermis, so or subcutaneous fat layer. You should not go into underneath the fascia, because underneath the fascia there are many nerves and vessels. Okay, so when cutting the threads, just pull a little, because if you want to produce a very powerful lifting effect, and if you pull too much the thread, the thread could come out and the lifting effect will be reduced. So just pull the suture, the thread a little, and cut as close as possible to the dermis, the skin surface. And after cutting, there could be some dimples at the entry point. It's very easy to release the entry point. You only have to pull the skin in the opposite direction, like this. Using a gauze will be more easier. This cutting is very important. So before cutting, it's better to massage or mold the forehead and this area because there should be a secure contact between the thread and the soft tissue. But Croquis has a very fine but strong curves, so there's almost no risk of the cog breakage. So you don't be worried about the reducement of the lifting effect. After cutting, there could be some fold here. You only have to, yes, just push a little. Okay, it's done. So I used mostly barb cutting. And this is just immediate after photo. Okay, the second video is for mid-face and low face lifting. Actually, for this patient, I try to lift not only mid-face, but also low face together. And first, a vertical line, which passes the lateral orbital canthus, and the connecting line between the mouth corner and the earlobe. These two lines are guidelines before making design. And this line is a horizontal line from the eyebrow, and this line is a horizontal line from the lateral canthus. And if you want more lifting effect for the low face, another entry point, just in front of the tragus. And if you want a jawline lifting, this entry point is very useful, just in front of the earlobe. But this time I used only 2 entry points. And I'm using thicker and longer thread now. And from the beginning, it's better to keep the constant depth along throughout the thread path. And if you see some dense structure here, due to very strong zygomatic or cutaneous ligament, the cannula advancement will not be easy. So then it's better to go a little deeper when passing this strong ligament structure. If not, if the thread is placed too superficially at the area of ligaments, after lifting, there will be some, the sunken area will be more aggravated after treatment. So it's better to keep your cannula a little deeper when passing this dense structure. But after passing the structure, you should be, again, very superficial. You should advance very superficially. And do not cross this imaginary line. Since these cox threads are just floating threads, so sometimes if I want to make more secure or strong fixation point, then I usually tie twice. I put 3 threads and check if there is any dimple, severe dimple, by pulling the threads. But minor dimples are not a big deal. So if you want to release a dimple, then you can squeeze the skin while pulling the thread. Okay, now I'm showing my tying technique. You can use these instruments to facilitate tying. I think tying twice is enough, but only once is not enough. Sometimes the tying will be released after insertion. So 2 times of tying is more appropriate. And then cut just above the knot. And if you put 3 threads, you can just tie 2 of them, and the last one, you just cut the thread without tying. Or you can tie all 3 threads, but if the knot is too big, then patient will complain about touching the knot through the skin. So I think only 1 knot is always a safe way. And for the lower face, I'm inserting from just in front of tragus. In this area, there is a parotid gland just beneath the skin. So if you insert too deeper, then you can damage the gland. And sometimes the parotiditis may happen. So it's better to keep very superficially when passing this area. If you are not experts and you are very worried about tying, then you can just cut the thread after pulling the thread. Tying can provide more secure fixation points, but sometimes after tying, the thread may come out from the entry point if the tie is released. So if you are very familiar with this technique, you can try not from the beginning, but after you became an expert. And the temporal lifting, it's the same technique as I showed you already. Firstly, when you insert from the entry point, go a little deeper because you should pass at least the dermis, full thickness of dermis, because this area, dermis thickness is quite thick. So you should go a little deeper, and then right after the passing the entry point, you should advance your cannula very superficially. Since this area has a dense structure the subcutaneous fat layer is very thin. So there's not much space, enough space to put the cannula. So that's why it's very important to be very gentle when advancing cannula. And as I already mentioned, this technique is very useful when patients are very worried about widening of their cheekbones after treatment. Then using this technique, you can lift mid and lower face without widening of the cheekbones. But if you put only the reverse technique, the result will not be that satisfied. So I recommend combining both direction together to reduce the side effect and to enhance the result. Okay, I think this patient is not very suitable patient because she has a very small sagging only. So, but we always listen to our patients. Okay, this lady had thread lifting procedure based on design like this. After treatment, her facial contour has changed much more nicely, and her eyebrows and upper eyelids are well lifted. Therefore, for some cases, we should consider about additional lifting for the mid-face to achieve better brow lift result. Before wrapping up my lecture today, let's briefly talk about the strong points of Croquis PDF threads. Why we should choose Croquis other than other companies' product. According to a recent study, 90% of physicians are unhappy with the quality of PDF thread used for the facial lifting. It is due to experiencing thread breakage in the process of storing the thread and an early breakage of the thread after the procedure, resulting in complaints from patients with rapid relapse. However, Croquis is the most fundamental and well-made PDO thread because Samyang company has been professionally researching and developing raw materials for PDO sutures since long time ago. And as we all know, 80% of all PDO threads on the global market are made from raw materials supplied by Samyang. So we can easily expect the quality of product from Samyang. In a 5-year stimulation test, the same conditions as the 15-day stimulation test at 90 degrees Celsius, Croquis' tensile strength has remained almost unchanged, while other companies' products have significantly lost their tensile strength. Croquis' bob holding strength is well managed by a high-quality assurance system from Samyang company. As a result, Croquis has an outstanding durability. If properly stored, the quality of Croquis will be maintained for more than 3 years. It's very surprising. Okay, this is my last slide, my conclusion. PDO thread plays an important role in controlling the face, and customized therapeutic approach, depending on patient's facial shape and skin type, is very important to achieve better results. And combined use of various types of PDO threads facilitates a more natural result. That is why combined use of multiple threads is necessary. Let me give an example. While you can only make delicious food with good ingredients, you can prepare an excellent meal by combining good ingredients properly. That is, in order to achieve better and more natural results of lifting, we should consider using various techniques and multiple thread procedure properly to maximize the desired results for the patients. Okay, that's it for my lecture today. Thank you for listening my presentation.
Okay, thank you very much, Dr. Choi, for your lecture today. And there's very interesting. We can see as on the chat box for the question, there's many questions that you will have to answer it, Doctor. Okay, for the Q&A session, I will invite my partner again from Samyang. Mr. Cho, can you join us?
Hello, thank you very much for the presentation, Dr. Choi, and thank you for giving me a floor again. I've got a few questions from the participants, and then I'm going to read one of them. And then also from ST Indonesia, you're going to give us some questions.
Yeah.
Okay. The first question is that from Dr. Christine that thank you for the lecture, Dr. Choi. I would like to ask, can we do this technique for making foxy eye or cat eye? And can this thread start from upper eyelid or lower bit then broad to give a foxy eye shape? That is the question.
Yes. If you want a more concentrated lifting for focal area to make foxy eye lift, and then I recommend to put more threads on the lateral part. I mean, if you put one thread per 1 centimeter space, and then put 2 or 3 threads to provide stronger lifting effect. But I recommend not to put too much thread because if you put too much threads, then the swelling will last longer, and the lifting effect will be reduced because after swelling, the tissue will become looser. I mean, loose, and the lifting effect will be reduced.
Thank you very much, Dr. Choi. And then I'm gonna give you a second question from Dr. Richard. And then he said, in my experience, this technique insertion with many PDO thread will hurt the patient and it's not comfortable for the patient and recovery time will be long. And what is your opinion?
I don't think so, because if threads are placed in the right space, right depths, and if the insertion technique was properly performed, then the patient's discomfort is not obvious. I mean, I know that 1 or 2 days maybe a patient will suffer from a little pain and a little headache, but after 3 days, at least 3 days, patient's discomfort almost disappeared. So, but if you damage some large vessels and there is a huge hematoma after treatment, then the downtime will be about 2 weeks. So it's very important to avoid any vessel damages.
Thank you very much, Dr. Choi. We have many questions from the participants, but
Yeah,
like, please
correct.
understand that I will summarize all some of the older questions here in the chat, and then I will answer the question via ST Indonesia. So please understand, and then it's time for you, ST Indonesia.
Thank you.
Your
Thank you,
questions,
Mr.
yes.
Cho. And we're going to move to the third question. It come from Dr. Sisi Yunita Surya. How long does this treat last? Will you combine with Botox at the same time? And what about the downtime? Please, doctor.
Please, can you repeat the question?
How long does this treat will be last? Would you combine with Botox at the same time? And what about the downtime?
Okay, I agree that eyebrow lifting technique cannot provide the same result as the lower or mid face lifting, because the area is very small compared to the face. The forehead, it has only 7 to 8 centimeters long, so the result will last less than the other areas. But I think when used more than 10, about 10 to 20 threads, then you can expect more than at least 5 months. And sometimes if a patient, for some patients, I saw that, I experienced that the result lasted more than 6 months. So I recommend another touch-up procedure for after 1 month, but I mean within 3 months. If the patient is patient's compliance is good, then I would recommend 1 month after the first treatment and add maybe half number of threads compared to the first treatment. And then I think more than 8 months of good results will last. And botulinum toxin, yes, I almost always combine, because in Korea, botulinum toxin is very cheap, so I can use, and I only need some at least 2 to 4 unit only. So it's very small amount to make a strong synergy. So why not using the botulinum toxin together? And also the downtime. Downtime is, it depends on the quality of the technique. I think for beginners, downtime will last more than 1 week, maybe. But usually the swelling and bruising will happen in the area of forehead or temple area. But these areas are very dense area. So even though a physician creates a huge hematoma, it's not it doesn't last quite long than other area. For example, if I create a huge hematoma on the cheek, it will last more than 2 weeks, sometimes 1 month. But for upper face, the hematoma usually lasts only 1 week. So you shouldn't be worried about the downtime if the treatment is properly performed.
Okay, doctor, thank you for your very holistic answer. Each point you answered it correctly. And the fourth question come from Kartika Lili Santosa. I have a complaint after getting a thread in the face. There is neuropathic pain along. How to avoid that complication?
Yes, I experienced some cases myself a long time ago. I think this is because the thread is too thick, or the physician put too much thread on a very small area. So, for example, here there are many nerves are passing through this area, but normally this kind of long-lasting pain or uh, mm, abnormal sensation usually last about 2 to 3 weeks, maximum 6 weeks. But in a very rare cases, I experienced a patient who was complaining about the pain for 3 months. But after 3 months, the pain disappeared. So anyway, it will last not over than 3 months. So either just wait and make some hot massage on the treated area, or if the patient has severe pain, then maybe you should remove the threads. But removing the thread after 1 month of the treatment is very difficult because there is already adhesion between the thread and soft tissue. So it's not easy to remove clearly. So if you want to remove, just remove before 1 month, within 1 month after treatment. But it's already 2 or 3 months has passed, then it's better to wait and see.
Okay, doctor, I think there is another, maybe I have to ask the permission for Mr. Cho. There's one more important question
Yes, please.
from Dr. Tita Ernawati. Now, Indonesia have been bombarded by Korea's product from food, skin care, fashion, lifestyle, especially aesthetic products from skin booster, Botox, filler, threads, and etc. Okay, we talk about thread, and each doctor must be already have their own favorite Korea thread. Give me a great reason to change my old favorite Korea thread and switch or choose Croquis for better result.
Okay. Um, Before answering the question, if I would, if I have to put threads for my family members, for my wife or for my kids or for my parents, I would use Croquis, not other products, because the difference lies in the product quality and efficacy in which they could maintain in the adjust position. I think Samyang has a superior manufacturing control and system, which enables a very high uh, quality of product, and um, it can promise high quality and high tensile strength that PDF thread should have. So I think just looking at the product, you may not feel any difference, but after insertion into the skin, then the quality becomes very important.
Okay, doctor. Thank you very much for your answer to those questions. And I want to remind for all the participant again, the question that are not answered yet, you can check to our Instagram at the croquis.id, CROQUES.id on Instagram. So we will post the answer on our channel. And also, I would like to invite again Mr. Choi to give information about Samyang Academy.
So thank you very much, Stefan, and thank you very much, Dr. Choi. To answer you more, and then if you any participant who missed the clinical video that Dr. Choi has shown, we have our academy website so that you can register and join, and then you can see wherever you want to see. So I'm gonna share you the screen of the video that for the invitation of Croquis Samyang Academy webpage. So please come to the sybsmart.com, or you can just take a picture of the QR code, and then you can sign in with your doctor's license, and then we will approve you to come in. We are more than welcome for you to join in our website.
Kita sudah berada di akhir acara. Terima kasih untuk para dokter yang sudah berpartisipasi hingga akhir acara. Nantikan next webinar kami selanjutnya. Stay healthy and stay safe. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.